we will be summarizing some of the best research that we found when writing this course that supports the injury prevention programs and advice that we will be presenting to you. Niedermeyer et al. Wrote that being physically prepared for skiing by training aerobically, anaerobically, and with high-intensity exercise for strength, power, balance, and agility more than once per week year-round will play a role in preventing both traumatic and overuse ski injuries. So stay in shape, do that aerobic training, add some sprints, do your strength and balance training, and just stay in shape year-round, and it will prevent injuries.
Kocher et al. Concluded shoulder and rotator cuff strengthening may allow for protective muscular splinting or resistance to muscle tendon injuries. We talked earlier about how one major way to injure your shoulder is if you reach out for the snow while you're falling and that arm is pulled away from you, or if you do a pole plant and that pole gets stuck and wrenches your arm back. If you're strengthening your shoulder throughout the year and keeping those muscles strong, you stand a better chance at resisting injury when those things do happen.
Kocher et al. Also said that agility and flexibility training may decrease the chance of joint injury, and in older skiers, overall conditioning may play an important role in bone density and resistance to fractures. So we know that resistance training and impact training can help improve bone density as we age and decrease risk for fractures.
Ellenberger et al. Found a skier with a strong core will have better force transmission and superior stability, with muscles bearing the loads of the spine instead of the joints, discs, and bones. They will have better balance recovery as well, lowering the risk for falls. So they're saying if you keep your core strong, that your muscles are going to take the strain rather than your spine. Also, this is going to improve your balance and all of your limbs attached to your core. So with a strong core, you're setting a nice foundation for the rest of your body.
Arundel et al. Compiled some of the best research on ACL injury prevention and said for the greatest reduction in ACL injuries, osteoarthritis, and total knee replacements, implement strengthening, stretching, neuromuscular, proprioceptive, agility, and plyometric exercises. So again, we're talking about maintaining our strength, staying flexible, and working on balance and agility in order to prevent injuries.
Wang et al. Found balance and agility to be the two most important aspects of fitness and affecting risk for ski injury. So we've already heard some talk about balance and agility in the previous quotes, but this group took all the different aspects of fitness and studied them to see if training particular aspects could have a better effect on preventing injuries while skiing. And they found balance and agility to be the two aspects where you could get your most bang for your buck in preventing ski injuries.
Malou et al. Said balance training with ski boots on familiarizes athletes with ski boots, ankle joint immobilization, and proper movement while downhill skiing. So put on those ski boots for some training pre-ski season.
Arundel et al. Also reported stretching can help improve flexibility for proper form while skiing. Stretch legs, lower back, and the trunk before skiing if there is limited range of motion in these areas. Dynamic stretches involve movement and help increase blood flow, loosen up muscles, and improve joint mobility. So they're talking about stretching, and they advocate that you should be stretching in times when you're not skiing if you have any areas that are tight, and you should be loosening them. You should also stretch these areas before skiing, and they advocate for dynamic stretching, which are these quick stretches where you swing around your arms and legs and stretch the muscles. This increases blood flow, softens the muscles, and is good for preventing injury before any sport.
Ellenberger et al. Stated the focus of knee injury prevention programs for skiers should specifically include increasing lower extremity stability, strength, ensuring adequate maximal eccentric hamstring strength to counteract quadriceps-induced anterior tibial translation. Keep those hamstrings strong. We're going to talk about that a lot in our exercises that we talk about for injury prevention. Optimizing intra and intermuscular coordination of the thigh muscles, for example, by plyometric jump training, and developing good biomechanics for landing, good alignment, less stiff, ideal quadriceps activation. Next, we will be presenting our beginner, intermediate, and expert injury prevention exercise programs developed based on the best and latest research that we found for downhill skiing athletes. These are the programs that we use with our clients to remain fit year-round and especially to prevent ski injuries.